Good now. Okay, so I'm excited about this one. We have part two. Last year we did an episode on peptides and other factors of hormone optimization. This time around, I wanted to get into some of the newer peptides that you're more excited about, different ones that you're playing around with yourself and your clients. And then I wanted to get into a discussion on some anti-aging medications, or medications rather, that are used off-label for anti-aging purposes.
Sure.
That'll be enough for us to talk easily for an hour. But with peptides, what are the peptides that you are most excited about? Some of the newer ones that people may not have heard of.
Well, probably my go-to, peptide is Dihexa.
Yeah.
I know you I've talked a little bit about it. Dihexa to me is just an incredible product. Full disclosure, before I gave it to any patients, I tried it on me. I use it intermittently because I think it should be used intermittently unless you've got brain problems. Then, it's okay. And the dosing that you'll find, depending on the place that you go to, will be different milligrams as a capsule for the majority of the time.
Okay, so this is not an injection. This is not an injection.
Right, it's not an injection, which is good.
Yeah.
And it's also good because, at least I think, using it as a cream is super, super better than any pill you could take. It's a little weird because you're like telling people, oh, you got to put it on your skin. But I mean, the absorption speed is really fast. I mean, when I put it on the back of my neck on Dihexa, and man, it's like within 10 minutes, I'm on. And I can go to work. It's focused. It's exactly what you want. And you can do it since it's a cream. You can do a dose, any variability in the dose. So for me, that is good. Why? In my practice, I have a lot of older patients that have family members, or they're getting close to having Alzheimer's and brain disease.
Yeah.
Dihexa is great for that. I mean, it's really good. And I use that product also on kids going to college or doing their schooling, and use that for them when they're trying to get their schooling done.
Right.
Because their focus gets better, and they're only going to do it, for a little while.
Why not stay on it indefinitely if it has so many neurological benefits?
I think for the old people that are, have a problem, I let them go.
Yeah.
For people like me, a little younger, I take breaks. So I'll do 2, at most 3 cycles of Dihexa a year. But that's me right now. In a couple of years, it might be different. But it's really has I don't want to say a bilateral, but it chooses to fix so many things in our brain that brain then functions, for that person without even thinking about it.
Wow.
And that was, one of the things that we talk about is that fear that men have, especially about estradiol in our bodies. Oh my God, they're like, and Dihexa is kind of like that because it gets people nervous, But I love Dihexa. I love it as a cream. Comes in an easy, little pumper. It really works. I haven't had a single patient have a negative response to it. Now, some people say it's a little, greasy on the back of your neck, so they don't want to put it on the back of their neck. Fine, I put it on your neck then.
Why the back of the neck? Is that just a high absorption area?
Slightly quicker absorption. Yeah. It'll take a little bit longer if I put it on my, my neck in the morning. If I've got to wear a shirt that's going to have something on it, then I'll use it on somewhere else so that it doesn't stain the clothing anyway, because it's a see-through cream, so it's not bad. But I got to tell you, man, that is just awesome. I mean, if I was to pick one thing on a guy my age, that would be right now, because all the other stuff I've tried, and just like the peptides, it's like doing BPC 157. Is BPC 157 great? Yeah. You shouldn't use it year round. You should try to heal yourself, get other things going, and a lot of what was going has been taken. So the FDA's just took a bunch of stuff from us.
Yeah.
So that's been challenging for us in terms of getting people, fixed with a lot of stuff that we used to have being taken away by the feds. And it is what it is, Just this morning, I had a patient call, said, "Hey, I want to get this stuff." I said, "All right, give me a minute. I'll call you back in a little bit." I called them back, and I go, "Yeah, I got the one, but I can't get the other one because the feds took it. The feds took the." It's one of these strange things again. He wanted to take Disinetab, which is a very strong, medication that people use for a lot of different sources. Rapamycin is a weaker version, and Disinetab is not. It's very strong.
Yeah.
And the feds just took it away. You can't get it now. So that puts us as physicians in a challenge, and that's why when we were talking, we might have even been talking before we did the phone call, was looking at what some of these people need to do, or I encourage them, like with the rapamycin. I always tell them, hey, I think you should go on some metformin. I tell them you should consider going on spermidine. I think you should go on what's it called, Fitocell or whatever. I get the name now all the time. And I give them all that information because that's what I think it should be. It should be information from me. The only information I'm not going to give you is the medication that I'm going to teach you, and you're going to take a drug. But if it ain't a drug, it ain't going to come from my thing. I'm going to tell you, these are the 4 or 5 things you should take. Go take them. Tell me how it is, because that's fair. Rapamycin, if it was not necessary to take as a drug, I wouldn't do it. I would put it on a pharmacy, not on a pharmacy, but on something else.
Yeah.
So, it's the learning process is good. Going way back now because I know we talked a little bit about Clomid. Clomid is a great product because you can really go forward and backward with that product, for men and women. A lot of women say, what's the guy doing with that stuff? It's a great product. It's a really good product that you can last for long, long years, and there's really almost no bad side effect with Clomid. Yeah. I haven't seen one, and Dr. Gordon, one of my fans, he's gone from taking testosterone away from guys from the PTSD and putting them on Clomid and having them function as well.
Yeah. I think what he does that's smart is he recommends a much lower dosing protocol than what most people take, such as 50 milligrams every third day, at the most 3 times a week. Because if you look at most online forums, when they talk about Clomid, they're talking about it in the context of a PCT after an anabolic cycle. And it's usually a pretty heavy dosage of 50 to 100 milligrams every day for a month. I don't even think it's effective in that realm, but taking the anabolics outside of it, just a regular person who wants to get a boost in testosterone, that's way too much to take.
It really is.
It's not way too much as in it's going to increase your testosterone too much. It's just going to lower the estrogen in your brain too much. You're going to feel like shit. I remember the first time I took Clomid, I was taking 50 milligrams a day for about 2 weeks. After about 2 weeks, I felt terrible. The estrogen in the brain was low. And then I had serious shrinkage too on that, and that's not a confidence builder. Okay,
that's right.
I'm already half Asian, all right. So I don't need anything that's going to cause shrinkage. Now, so I was like, forget Clomid. I was like, I'm never going to take that stuff again. And then I was talking to Dr. Gordon on one of the LLA show episodes, and he goes, "Yeah, that's way too high a dosage." He goes, "I bet if you took 50 milligrams every third day, you would have a pronounced increase in testosterone without any of the negatives." And sure enough, he's definitely right about that.
It's funny you bring that up. We're just going in the circle talking about rapamycin. You can get, rapamycin, you can get in a very large dose, but you don't do it because you don't need to do it, So it's funny how, the discussions go along like that. You say, you know what, you don't need to do that. Like Thibodeau just said, a couple of weeks ago or a couple of days ago, you don't have to do that. Why are you taking all this testosterone? And then I got to deal with my patients that come in and they, think, well, I need to do more. I go, what do you mean you got to do more? Well, I got to do this. And I look at their numbers. I go, well, first of all, you've got so much thick blood in your body that you're going to have a problem here, dude.
Yeah.
You're off all the numbers and you want to take more, testosterone. I go, for what? Oh no, I can't, I gotta not lose my muscle. I gotta stay strong. I go, well, you keep this, you're gonna give yourself a problem, and they just think that a number is going to be correcting them, and it isn't. It's better for what you and I have talked about in the past. It's better to go at a 75% than 100%. I mean, it's rare that you got to go 100%, And
Right.
if anything, I tell the patients, hey, listen, why don't you're going 500, you're doing 50%, just stay there. Tell me if there's a problem. If you got a problem, we can talk, because it's usually another related problem. It has nothing to do with testosterone.
Yeah.
It's something that you got to spend so much time, like you do, in educating another person about how to do it, instead of just they think they're going to get a pill and it's going to be cured. No, dude, that's not how it goes. You got to take care of yourself and do things, and that's why Gordon he is such a cool guy, to go from what he had with all those PTSD guys, and then was able to turn him over with no alcohol. I'm like, wow.
Yeah. It's no joke.
How are we talking, or why are we talking about this all this?
Well, let's rewind back a little bit about Dihexa, because in terms of the mental benefits and focus, how would you compare it to something such as Modafinil?
Okay, good question. Number one, the Modafinil can be a little bit quirky. You might be a little bit too aggressive or too focused, if such a word exists.
Well, I mean, as someone who's taken it many times, I know exactly what you mean.
Yeah, and they're going. I mean, but when it's over, it's over, dude. They're like, And the Dihexa, for me, I take it first thing in the morning, and I still feel a little bit by 10 o'clock at night. So that's a long period of time. And the Modafinil, I think if someone really medically needs it, I certainly would give it to them and encourage them.
Right.
But it's also gained its place now over time that more people want Modafinil. And why do they want it? I mean, I got a lot of cops that were begging me for that stuff.
Really?
Like, well, I'm going to be working the night shift, blah, blah, blah. I'm like, yeah, what else are you trying to work on? Because, you're not doing it just for that,
Yeah.
So I think, that's where some of the medications that are out there are not as good as we want, because they're made in a way that we could use them in a maybe milder fashion and not cause as many problems, like the Rapamycin does, like Clomid does. I mean, if you take too much Clomid, you're going to have a problem. But you take one or two, maybe, you're probably going to be good for a long time and not need test and not a lot of any of that stuff. But,
I'll tell you, the only side effect that I've noticed with Clomid is that when you're taking it at the right dosage, that is that it tends to lower IGF-1. I don't know if you've seen that with your patients.
Yeah, but I do. I have had it, and I think part of that is when you look at how test testosterone for the observers to make a change or a call on it. It's all kind of tied together. When you are taking testosterone and then maybe you go into Clomid, you got to figure out how you're going to do that. You can't just stop it. The Clomid will stop slowly if you want it to, if you take it off and all that. But you got to figure out this a little bit better. I don't know if I'm talking, in a confused state here, but I think you need to get a target point for those kinds of hormones, because when you take Clomid away, that person's going to go back to what it used to be.
Right.
And it's not, there's nothing wrong with that, but I don't know, I forget what we were talking about, the Clomid thing.
No, we're just talking about side effects. I said one of the things is I have found it lowers IGF-1. Now I take peptides.
Oh, IGF-1.
Yeah, I take testosterone, I take CGC, I cycle on those. So I'm getting a nice boost. The last time I did a blood test, I wasn't taking any peptides that increased growth hormone, and I noticed that the IGF-1, that was the only negative of the blood work I did maybe 2 months ago. Is that
now that you bring it up, the IGF-1 I do see, yesterday alone I had 5 people coming through on blood work, and most of them were fine. Their numbers are really good. And then you have someone who's a little younger, middle age, say, and they're not getting the numbers. And I always try to teach my guys, hey, listen, IGF-1 is not meant to be IGF-1 like it was for human growth hormone. We're using this a little bit more specifically. And some of these people at a younger age really have lower numbers. And I think from what I have seen, a lot of this is because they don't take care of themselves the way they think they do in terms of the kind of food they take, how much they take it, alcohol use, whatever. It's those little things that they just assume is not a big deal. It can take a 200, IGF-1 down from 200 down to 110. Yeah. And what are you going to do? I'm like, well, what happened to me? I go, what did you do? Well, they never agree to have done something bad. That's part of the problem, and then sometimes you get the reverse. You get these older people that have been taking care of themselves, and their IGF-1 level is like 250.
Right.
Yeah, and this is an older lady, and I'm like, wow, that's amazing.
Yeah.
So it's part of that is learning how to treat these people and how to talk with them, because a lot of them want just a quick fix is what they want. We can't do that. Even if you give them IGF-1, I give IGF-1, for patients, intermittently for a long period of time. Athletes, of course, you can't take it too long because they're going to test positive. Right. But there's a lot of older people that fall down, and they come to see me and they got to have something fixed and they want to heal faster. I'm okay giving a 75-year-old some IGF-1 for 2 months. I'm totally fine with that. And they do better. But is that better than taking HGH in the old-fashioned? No. I think actually that's the opposite. And I do think that CJC and IPA, like we discussed, I think is a better product than HGH like the old days, because of the longevity of a daily, distribution of medication. Yeah. As far as IGF-1, listen, it's out there. That probably will be taken away in the next, year or so, because, feds are going to say, why are you using it? So but a lot of people use it. I think it's a good product. Just take a break. I always tell patients to take a break.
Anything you take for a prolonged period of time, you're going to become desensitized to. You're just not going to feel it anymore, and the benefits are not going to be as pronounced.
Yeah, and that's part of the things that when those things that cross your brain barrier, you need to. That's where some of that loss goes, because if they take something and then they lose their sensitivity because they do something too much, well, then that's not going to function for them. So that's why, like I was telling you for the Dihexa, that's why I take breaks, because I let my brain kind of defunctionize and break up and just take a relaxation mode and then go back to it when and if I need it. If you're older though, yeah, you're going to need to do it. Like if you have Alzheimer's disease or Parkinson's or anything, you're going to need to take whatever you can. But
this can help mitigate the symptoms of Alzheimer.
I think so. I think without a doubt it does. I mean, that was the original source and reason why these docs started it. Yeah. And I think it was at Manmount in New York. And like so many other things that we do, we started giving it to someone for a brain thing, and all of a sudden it goes different, But
it's like Viagra with blood sugar or heart health. I think that's what it was designed for initially, was improving heart health because of the nitric oxide, of course. And then I guess everyone in the study just started getting massive erections, and they realized, and they're like, hey, can I get more of this? And they realize, hey, wait a minute, we got something else here.
Right. And that's why one of the reasons why Cialis is basically, or I think it's causing it, it's killing the original source, because Cialis figured it out. They said, we're going to break this stuff down into little pieces and give you what you want and what you need. And these guys can go from 10 to 25 mgs, It makes a big difference, when you're doing that. I mean, you need 25 on one day a week and you only need 2 or 5 the rest of the week. you're doing fine.
Yeah.
You know?
Yeah, Cialis seems to have some additional benefits too. It lowers estrogen a little bit. It increases testosterone a bit. I mean, not super. You wouldn't use it as a replacement of Clomid or TRT, but it actually does increase testosterone and lower estrogen a little bit. And then it seems it has circulatory benefits too, so it's good for your heart. So I think it can be abused, but there's actually, old joking aside, some real health benefits of using Cialis.
Yeah, I mean, I got to tell you, I've had enough patients that I don't see any, if you're doing the right dosing, I've never seen anyone have a problem, you know, and I think it's a good product. It has a lot of positives, like you said. You know, can you use it for recreational stuff? Go ahead if you want to do it, you know, but the feds are going to block you down anyway, because they're going to say, well, you know, you can't, when you get your prescription at the pharmacy, you could only have 6 pills for the whole month. I'm like, really? Okay. All right. So give me 25 milligrams, 6 for, you know, for 6 doses, because I'm going to cut this little baby up.
Right.
But it, and that's, you know, the price of some of this stuff, medication, you know, you got to go to the right place, because, you know, some places, the pharmacies, you know, really gouge you. Whereas you can go to Walgreens and be charged one thing, and then you go to, you know, not a health food store, but like one of the other stores that sell food, and all of a sudden the prices are less. You know, like how does that happen? You know?
Yeah.
You know, but it is what it is. You know, I don't know how we got onto this one, but
be the cheapest for prescription medications, I believe.
Yeah, I think probably it is. Yeah. But you know, hey, if it's cheaper, you can get it. You know, as long as it's a real thing. Don't always get it over from you know, outside of the country, because sometimes you don't get what you think you get. So.
Right. My dad used to get Viagra and Cialis out of the country, right? Some offshore pharmacy. Mm-hmm. My brother's all, well, how do you know if it works? And my dad's like, well, Roger, of course I'm going to know if it works.
I bet he did.
He's like, I'll show you next time. I'll show you.
Well, that's and you know, women benefit from Cialis as well. So,
yeah. Right. What's the mechanism there? It improves arousal, or what's the benefit?
Yes. Yeah, they get more edema in the tissues, so it swells. So you know, you can figure out the rest.
It gets a lot bigger. Is what we're talking about here.
Yeah, right.
You see a clip that looks like a thumb. It's because it might be. It's not always anabolics. Could have been Cialis.
Yeah, usually this, you know, it depends on how tall you are and how, you know, how big your thumb is, but you know, she may be bitching at you going, I can't feel that thumb anymore. You better get this going, otherwise I'm going to find someone else. So, you know.
And on that note, let's transition into rapamycin. That's a good
segue. There you go.
Okay, rapamycin is really interesting because I see a lot of conflicting information on it. On one hand, people put it out there as an incredible anti-aging drug, and we can get into some of the reasons for that. And then on the other hand, there's some data that says that it can be very toxic to the liver. Is that more dose related, or what do you think are the concerns people should have with rapamycin?
Yeah, for the people using it for, you know, life, you know, living longer, it's the dosing. It's 100% the dosing, because you're going to take something small, 6 milligrams. You know, occasionally I'll let people say, okay, go up to 9, but I'm not going to let you go up any higher. And that is a very low dose, very safe. Occasionally at the beginning, when you start taking it, you might have that same little bit of nausea, vomiting at the beginning. But if you take too big of a dose, you're going to be out of the you know, the right place.
Sounds like you should start really low with something like this, and then just gradually titrate it up.
Yeah, I certainly do. I mean, the average American in Las Vegas will not do that. He'll go, I want you know, they want it from the beginning, men and women. And I go, listen, why don't you just try the 3? And I'll give you 3 milligrams, and I'm going to give you enough for 3 months. That way, if he wants to take 6 milligrams, he can take 2 3s and see if there's any difference. And a lot of those guys will say, you know, I took it, I like it. And I go, well, was it different? Was it better? I don't know. I'm like, you really, you're taking more stuff and you don't know what it did.
Yeah.
Well, yeah, I think I felt better. I'm like, okay. So I'm thinking to myself, I should just give them, placebos and see what happens.
Yeah.
But yeah, overdoing it just seems to be the centrum of the conversation today, because what we're talking about really is so many people want so much stuff, and you really don't need that much.
Right.
And you're better off, so for me, that product, I wouldn't worry at all,
Now, for people that work out and are looking to build muscle, improve strength, and all that, doesn't rapamycin not deactivate mTOR, but doesn't it attenuate mTOR, lowers mTOR, which is an activation switch for building muscle? Isn't that mechanisms that helps? Because mTOR is an interesting compound, because on one hand, you want mTOR to build muscle, but if you have too much, it can start fueling cancers and other things that you don't want.
Yeah. It certainly, that became part of my life, back in the 90s when, I was a big mTOR fan. Everything was mTOR.
Yeah.
And then I went to AMPK, and I went, it's funny because when we were talking about this today, I was thinking that our Hebrew friend from Israel, remember his name?
Yeah.
I'm blanking his name.
You're talking about Ori Hofmeckler?
Yeah, Maury. So Maury, he was great because he taught his guys that you got to be able to go for long periods of time without eating. And so he got away from the mTOR, and he got into the long time period without food, because you had to get ready for that. And I fell into it like that. I said, I started not, eating the other way. I start eating in a very small fragment of 4 or 5 hours tops in 24. It's mTOR, yes, but what I choose, the proteins I choose are different. I don't choose the bad ones.
Right.
So in that regard, I think mTOR is good. We need it. But if your goal is to be bulky, you're doing the wrong thing, because it's going to crash sooner or later. It's getting back to that thing that you were talking about, when you've taken certain medications like testosterone and you take it at a dose that is compatible for you, it gets you where you want to go. Right. So I do this crazy stuff that people are doing. And like we said, I see patients all the time. They're always wanting to do more and more and more. They want more thyroid. They want more testosterone, and or the men don't want estradiol. I'm like, well, okay, dude, there goes your brain memory. All right, forget it.
Even in the anti-aging world, not that long ago, I want to say about 15 years ago, there was a lot of bad advice of get testosterone as high as possible, get estrogen as low as possible. I would hear actual anti-aging physicians say that's the goal. And that's why so many different, and that's why the supplement industry started making estrogen blockers left and right, to that, because there's this paranoia of estrogen. I mean, basically the whole soy milk industry was put out of business. I mean, it's still around, obviously, but it was hit really hard because the competitor marketing was that soy increases estrogen through the roof. If men consume soy, they're going to start developing gyno, which is completely incorrect and erroneous. It's not even, phytoestrogens and estrogens are two completely different things.
Yeah.
You would have to consume a ridiculous amount of soy for it to even be a problem. If anything, there were some doctors who used to give, Dr. Eugene Shippen used to give his patients 25 grams of soy protein to help block the conversion of testosterone into estrogen. And that was back in the 1980s or something, in the 1990s.
I remember that book. Yeah,
the testosterone syndrome, something like that. So, but there's this what's funny is that while there's this paranoia of estrogen, I've never seen a more estrogen dominant society than ours right now. I mean, you and I could walk out the door and within an hour, I have this bad joke that a lot of couples look like lesbians now. I'm talking about straight couples, okay? I have this whole rant I put up. Funny thing is no one can offer a counter argument, no matter how offensive they found my choice of words or analogies, but it's funny, but it's accurate. And here's what I mean is, you see a lot of guys and you see a lot of women at a certain age, couples that have been together for a while. He has short hair, she has short hair. He has chest body fat, she has chest body fat. He has lower body fat, she has lower body fat. He has a gut, she has a gut. They look interchangeable right now. They look like a lesbian couple. I don't mean lipstick lesbians. I mean not Jerry Farwell, but who's the other guy I'm thinking of? But anyway, people know what I'm talking about. And I say this as a joke, but I also say this as a warning of what's not acceptable. I mean, this is totally unacceptable. The bar is so low now for men where no man should tolerate this, having this syndrome. So on one hand, people are paranoid about estrogen, but on the other hand, it doesn't look like anyone cares really, because I see estrogen dominance so pronounced that I wouldn't even have to look at blood work to know this person has massive levels of estrogen.
Yeah, and it's really sad because what we're seeing is even bigger than what we just were discussing, because when you start looking at television and how they approach how people should be responded to, and the size of the person that you're seeing on TV, and we're going into this hole very quickly. I mean, and it's like, why are these people doing this? And a lot of them, at the beginning when Clomid hit in my office, it was crazy because these people didn't want to do anything. And then they came out, whenever the big surge, and they came to see me and they go, well, what happened? And they go, well, I got COVID. I go, you got COVID. How long were you in there for? Well, about 7 days. Yeah. And when did you last, have any dietary issues? Well, I've gained a little bit of weight. How much? Oh, about 35, 40 pounds. I go, you gained 35 pounds. How'd you do that? Well, I wasn't doing anything. Well, okay. Well, that's what happens, and they use it. And it's just
whole lockdown show. Remember when everyone was locked down, everyone stuck at home? How many people started working out as a result of that? No one. The only people that worked out were people that were already working out. So the excuses that people always use, I don't have time to eat right, I don't have time to exercise. Okay, well, we had 2 months almost of no one's going to work and everyone's sitting back at home. And even then, nobody worked out. Didn't even walk around the block. People just watched Netflix all night and ate garbage food.
Yeah.
So it just showed you. I mean, I always thought it was a lame excuse to start with, but it just showed you that that's not the problem. The problem is lack of time. The problem is lack of desire, the lack of motivation. But I always say, why do men have to be motivated to want to be strong and fit? Why is that something you even have to try to convince another guy of? That should be something innate in you that you want to have that.
Absolutely, should be born immediately and go. Because that's your life will be better. And these people, and that's what, we said a bit earlier, everything is getting, worse in how they are handled. The TV is not handling the things right. The magazines are not, using the right things because they're giving the wrong image. And everyone, it's okay to be fine. You can do whatever size you want. You can do whatever hair color, sex color. I'm like, man, I don't really care about the sex. But if you're going to let yourself go, an extra 100 pounds and say to people, well, it's okay. I'm one of those people in the mix. I'm like, whoa, okay, maybe not, and it's tragic because all these people have gotten these false feelings of success and they haven't. That's bad. You and I are sitting here talking about making things better. And I don't see that kind of technology or discussion by those other people. They don't even talk to other people about their own friendship about, hey, let's go do this, let's go for a walk at least. But it's impossible.
Well, I mean, look, people can. It seems to be this move to make both genders exactly the same right now, so that there's no discernible difference, which is ridiculously unhealthy and also just not. It's implausible. It's moronic on top of everything else. Yep. But what I see now is more and more male behavior where you're losing the better qualities of masculinity, in my opinion. And one of those is just protective instincts, right? Like when a man has high testosterone and his hormones are optimal, you're not a bully. You're not trying to get out there and oppress people. You develop these protective instincts, almost like you're a protector of people around you. Yeah. And what I see now is men with women, and they don't even open the door for her. They just open the door and walk right in. Yeah. Or you're at a restaurant and you got these two guys that are 25 sitting on the bench, and there's two women that are 65 standing, waiting. And these guys aren't even offering their chairs. I mean, they're not even offering like, hey, would you like to sit down here? Nothing. You know, like these people may seem like, oh, that's just old fashioned chivalry and all that. I was like, no. It's not that simplistic. What I'm saying is these guys don't have any of those protector instincts that I'm talking about. No situational awareness. They're completely oblivious. Now, this may sound like an insignificant situation, but you think anything would be different in a significant situation? You think that if these two women got attacked by somebody, that these two fucking pussies that wouldn't even give up their seats are going to do anything to help? No. It's like you can't even give up your fucking seat for a woman to sit down. You can't even offer. You're in fact, forget about you can't even offer. You're so oblivious that you don't even notice. You know, it's like
all we're getting is more of this.
Yeah.
We're just getting more of this crap. That's terrible.
Yeah.
I mean, I don't care what you eat, what peptide you think, whatever, whatever. It doesn't matter. If you don't do it the right way,
right,
you're going to trash yourself. And it's they always want the quick resolution. They don't want to change. They don't want to suffer. I'm like, well, you should probably find a different planet because but it seems like we're the ones that don't want to be on the planet because they are behaving in a way that you and I wouldn't.
Right.
And that's the scary part for me.
Everything now is about let's cater a society to the weakest people in society so that they're not offended, so they don't feel left out. Yep. That's not the way nature works. That's not the law of the jungle. And at the end of the day, we're all animals. When I went for a gorilla trek in Uganda with my parents and my brother, we came across this silverback gorilla with a whole entourage of his whole group, right? His whole tribe. Now, all the smaller gorillas came in first, and all of a sudden this huge silverback came in, and this silverback just exuded confidence, right? It's the reason why the silverback's the king. Now, all of the female gorillas, they rather share him than be with the other male gorillas, right? Rather than be in monogamous relationship with the less gorillas, these women are like, no, this guy's the baddest motherfucker right here. Five of us rather share him than be with these other guys.
Yeah.
No. Everyone felt better as a result of this guy being in the group. Now, I'm not saying that this is how society should be, but what I'm saying is you shouldn't try to quell the strongest members of society. See, now it's about penalizing. I mean, if these gorillas were in our society, it'd be like, okay, we need to tone down this silverback because it has too much power. Yeah. Make sure that the other gorillas don't feel inadequate. It's like, well, look, it's good to feel inadequate because that's what makes you improve as a man. I don't even think it's bad to get bullied. I'm not saying that people should get bullied and encourage it, but I always say that every young guy needs to get punched in the face at least once. Okay, and here's what I mean by that is 2 times as a young person, I got punched in the face. Both times I was mouthing off saying stupid shit. Now, what's the lesson I learned after the second time? It's like, you know what? If I didn't say anything stupid, I wouldn't have gotten punched in the face. Right. So maybe I shouldn't act like a douchebag, Maybe I should just be a polite, cool person, and I'm not going to have this unnecessary conflict. Yeah. So when you meet these men that are in their 40s and they still have to be the center of attention, and like every time someone says something, they have to make a joke because they think they're in some kind of comedy act. Those are people that never got their butt kicked, but they needed to get their butt kicked. That's why they're 50 and they still act like an adolescent. They still act like idiots.
Yeah, no, it's for sure. It's so sad because the number of them seems to be growing and our numbers are stable or going down.
Well, no, let's make stronger people weaker so that weaker people don't feel as inadequate. It's like, okay, well, why don't we make weaker people stronger instead? When I was growing up in the 1980s, we'd watch movies like Commando and Predator and Rocky 1 through 3. And every guy in the movie theater would be excited to go work out or go take a karate class or go do something, physical. Because we're like, man, I want to be like those guys.
Right. Exactly. But
it wasn't like, slowly, I'm so inadequate. It's like, I want to be like those guys.
Yeah. It just mutated slowly, and it's bad, hopefully it'll change around someday. But,
I mean, people may think that we're overstating this problem, but I'll tell you what. You go talk to people in the military. Right now, we have a national security crisis because we don't have enough people that are fit to join the military. Yeah. That's a real issue. Forget about Navy SEALs in elite branches of the military. I'm just talking about just the entry level area. People can't do 5 pull-ups. People can't do 20 push-ups. Yeah. So it's a national security problem. What if what we have right now, this obesity crisis, is 30% more in 10 years? I mean, that's going to be huge. What if this country got attacked and it was up to everyday citizens to defend it? You just get run right over.
That's exactly right.
How many guns people have? Like, well, I got 10 guns. Like, yeah, but you have a heart attack if you run to your mailbox. Right? Your guns are not going to do you much good unless you're just sitting in a chair waiting for people to come through your door.
Yeah, no, you got it right, man. You got it right. It's tragic. It's really sad, but it is what it is. We can try to change them. We can try to point them in the right direction, but they're going to be, if they're lazy, they're going to get screwed over. That's just.
Well, I think it's important for people to be look, I'm unapologetically masculine. I don't care if that makes me a barbarian. I don't care if the feminazis come in after me. That's just who I am. I'm not putting on an act. This is just who I am. And I'm not going to pretend to be otherwise. Mm-hmm. Now, some people are going to gravitate towards that because they're going, whew, this is refreshing. Other people are going to be like, oh, that guy's a thug. He's sexist. He's a barbarian, blah, 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 blah. That's fine, too. Fuck off. You can find someone that caters to your dipshittery easily. I don't have to be the guy who has the message for everybody. I put out my message in a very concerted way and attract the right people for me. So that the kind of customers I deal with are great people largely. It's very rare that I deal with someone that.
Hey, that's what the silverback did, right?
Yeah, exactly. That's the lesson you learn, when you see a silverback in the jungle. But it's innately we respect strength. That's just the reality of it. That's why so many guys try to overcompensate. That's the other problem too, is that you have people that are weak and proud of it. And then you have people that are weak as well, but they try to project that they're not weak. They overcompensate. Oh, yeah. Those are both. I mean, that's even worse than someone who's like, yeah, I'm weak and I'm okay with this. Like, okay, well, at least you're honest with yourself. And then you have people that are, then you have people that are weak, but they're like, yeah, man, I'm a badass. I got my beast mode t-shirt on. Yeah. Look, anytime you see a guy wearing a t-shirt that says alpha, you already know he's not a fucking alpha.
Yeah.
He's got a Superman shirt on. I mean, come on.
I get that from my wife. I got like 55, 60 t-shirts in my house, and they're all the stuff that we're just talking about. Like the one I got on today, never stop training.
Yeah.
Well, how is that? I mean, that's just the way my life is, and it's.
I'm gonna put on a little kitty t-shirt that's pink and then go deadlift 700 pounds. It's like beast mode that.
I'm gonna go and watch you do that.
Just to fuck.
If you do it, I'll get there with you, and we'll walk on that shit together and see what those motherfuckers say. Look at this guy wearing pink.
I'm gonna have those pink socks up to my knees that the CrossFit girls wear.
That's another thing about people with those CrossFit socks. What part of their body is getting damaged that they need that piece of stocking that tall?
I mean, I wear the long socks for deadlift so that my shins don't get destroyed, because my shins because I pull the bar into my shins.
Yeah.
But I only wear it on days I deadlift, which is pretty much every time I work out. But if I weren't deadlifting, then I wouldn't wear the socks. Yeah.
Yeah.
They wear fashion. They wear the short shorts and the long socks. Now, hey, they look good in it, so it's okay.
I got you. No, I'm in agreement. Yeah, for sure.
I don't mind. I don't see women in those outfits and go, why are they wearing that? I'm just going, man, she looks great in that.
Yeah. But then there are others that don't look so good.
No, that's definitely true. Definitely true.
The ones that constantly walk on the treadmill for the whole time. There's no jogging. There's no running. No, there's just, I'm walking.
Well, that always amuses me that you're going to drive to the gym and go walk on a treadmill. Why can't you just walk around your block?
Yeah.
Probably going to be some hills too. Like here in Seven Hills, there's quite a few hills that Raina and I come across every day when we do our walks. And also, I'd rather be outside and see some nice scenery than be on a treadmill.
Yeah.
Looking at a TV screen for an hour.
They should, as far as I'm concerned, they should take all that stuff out. Forget it. Just take it out, put it outside. Yeah. Because at least you get some sun for those people. All right, so let's talk about something else here because.
Yeah, nice little segue here. Okay, so we talked about rapamycin, we talked about the Dihexa. What about? Okay, let's talk about metformin a little bit, because here's my experience with metformin. I've used metformin several times, and it definitely improved fasting glucose. Mm-hmm. My fasting glucose can run a little high. It can be around 87, 89. And I like it 80 to 85. And metformin definitely put it in that range. Actually, just one 500 milligram tablet did that. So I didn't even have to take multiple dosages. But I also found that I get the same exact benefits with berberine. Just a good extract of berberine. And that's what I take now instead of metformin, because you don't have to worry about the potential gut issues and other things, which are probably dose related with metformin. But it seems that berberine works in almost an identical manner without the side effects, at least not that I'm aware of.
100% agree. I mean, I do think that, the metformin has been there before and people got used to it, but, berberine is equally as effective, and I see no reason why to use both. If you're going to use both, fine, and back the dose off, if you really want to do that.
Because berberine has the same effect on AMPK as well. Metformin does.
And it's not cheap. Berberine's not cheap, It's a lot of our good supplements.
Significantly cheaper, right? Metformin's actually cheaper. That's true.
Yeah. So you got to wonder, which is better. I mean, I think they're both very good. I think metformin, is probably a right choice for most people, especially for the extended release.
Yeah.
It's easier because you're getting a slower distort, kind of support, which the berberine does as well.
Right.
But I think it's one of those things where it's very similar, and we're going to see that for a long, long time because some people will just buy the berberine because it's more expensive. They go, oh, that's got to be better. It could be, but it's probably pretty close to 500 milligrams.
The cool thing about berberine too is it definitely has a positive impact on lipids. Cholesterol numbers improve quite a bit. HDL is up, LDL bumps down a little bit. I mean, there's controversy on cholesterol as well. Some say it doesn't matter at all. Your cholesterol's through the roof, no big deal. Others say you want it as low as possible. Most likely, the individual variation is going to be a big factor in something like this. But my attitude is if my cholesterol is really low, but my testosterone's high, then I'm not concerned about the cholesterol being too low.
Yeah, right.
If my cholesterol is really high and my testosterone's low, that's definitely not the combination I want.
No, it's not. But I do think that cholesterol is overrated in terms of that you got to drop it down lower.
Right.
It's something that has, happened because of the drug industry.
Yes.
We need to keep a certain amount of cholesterol in our bodies, to function properly. Right. If you don't, you're going to have a problem, So simple little things like that, the doctors nowadays just like to pound that stuff and say, oh no, you got to take statins, you got to take this, you got to, I'm like, oh, come on, man, you got a glucose or a carbohydrate load of this and that, and you're all crazy.
Yeah.
It's money.
Cholesterol should be, I think the vast majority of people can get their cholesterol into a healthy range with just modifying their diet.
Yeah.
Taking some supplements. But I think that statins should be a last resort, if anything, if even an option at all. But it definitely shouldn't be the first step that someone takes. I think that's absurd.
Yeah, it's 100% agreeable with you on that one. It's overdone, and it's done not done enough. We just got to look at things more realistically and not just assume everything.
Right.
Right. It's sad. I mean, I think carbohydrate dose will change that too. So there's so many things flipping around in the air that how do you know, if it's cholesterol or something else?
Well, I think that's one of the things that's intriguing about metformin is that insulin's a master control hormone. It's arguably the most important hormone to optimize, way more important than testosterone. It's the most anabolic hormone as well. Doesn't mean you want it through the roof, but you want to have a healthy insulin response and then a subsequent really good fasting glucose. Now, something like metformin actually helps a lot with that. I think people lose insulin sensitivity a great deal as they get older, and more specifically through just poor dietary habits that accumulate over time. But that's a big problem. And I think quite a few people are in that pre-diabetic stage without even realizing it.
Yeah, I'll tell you, it's so usual to be seen that when I have my patients come in and get their blood tested, I do two things there, and those are both attacking, what the spillage of a little bit of sugar is doing for these people, because I want to know what they're doing, where they're flipping off and where they're not doing something right, and it's you got to do that because you got to keep them, focused on what is going to happen. If they go, well, okay, yeah, I ate some carbohydrates and I'm a little off. I'm going, okay, we'll check you in 6 months and we'll see if it's worse. Then we got to start talking about it.
Right.
But, they want to be, they want to be easy, and easy does not mean you're going to take a bunch of, statin drugs and then go do whatever you want. That's not how it works.
That's what people think they can do, though. That's the problem.
Right.
Because sometimes, my doctor said that I need to change my diet, or he can get me on a statin. So I took the statin. I hear that kind of thing all the time.
That's a big mistake right there. Yeah. You always go for the easier stuff. But in the society that we live in, it goes back like we talked about the people that are all uniform. They don't even want to change. The doctor, you go to the doctor's office now, unfortunately, they don't even look at you face to face. The doctor's looking at the computer when he's talking to you. And I'm like, okay, dude, all right. Is that what I'm going to get? No.
Do you find that people overly fixate on numbers too much when they're treating, like physicians just treating people? They go, okay, you're within the normal parameters, so you're okay. And sometimes sometimes people have a total testosterone of 700, which for most people would be a really good number, and their free is 85, 90 on a scale of, let's say, 50 to 155. And those are pretty good numbers for some people, but that individual may feel terrible at that. That individual may need to be at 900 total or a free of 150 to feel at his best. And then someone else may be perfectly fine with that, or even significantly lower and feel really good at that.
I'm a big believer that the ranges that we see on blood testing is very inaccurate to me, because how they get to that, delete the 10% low and the 10% high, and we're going the normal is this 80%. Well, how the hell did you find that out? Yeah. I mean, because most of the time what they do is they draw blood innocently from the patient without telling them. They get it so they can test it. Okay, so now if you've tested this stuff and it's 10% out and 10% in, and you got 80%, well, so that's the range? No. I mean, how often should you change that range?
Right.
How often should you change that blood? So these numbers, I mean, it's a numbers deal for money, and you got to be careful, because sometimes you need something and sometimes you don't, and it's like what we've been talking about, everything today. It's people want the easy way. That's not the easy way, so it's is what it is, But I think that figuring that out is important,
Oh yeah. Just with this whole thing with testosterone to estrogen ratios too, one more point on that is, I always thought it was absurd that you try to get someone's total testosterone, let's say to 1200, and their free testosterone to the top end of the scale, let's say 155, depending on the test. This is Quest Diagnostics. Mm-hmm. And then, but now the estrogen is supposed to be between 20 and 30 estradiol, even though the testosterone is at 1500. I mean, does it matter if the estradiol is at 60 when someone's testosterone is 1500? Because the ratio is still really good. And of course, if your testosterone goes from 500 to 1500, there's going to be some conversion into estrogen just to keep things balanced. So, I mean, 60 for estradiol is probably not bad if your total testosterone is 1500, versus 60 is bad if your total testosterone is 450, for example.
Yeah. No, it gets confusing because, what we're talking about, these guys that want these high numbers of testosterone, you may or may not need that. Now, when you look at the estradiol, we as males and females have receptors in the brain that only cater to estradiol. They don't cater that you can't get estrone or estriol in there.
Right.
You need to have some level of mental capacity for your brain to function on estradiol. So you see that a lot with guys that used to take blockers, estrogen blockers, because they wanted to not have that. And in reality, you really should have some estradiol. Right. The question is, like you were just bringing up, is the amount. And you need to have some so that your brain fog does not accumulate in your brain. You want that. So does your estradiol have to be commensurate with that testosterone? Probably not, because that testosterone is probably overblown.
Right.
My patients very commonly to have an estradiol of 40 to 60 milligrams. I mean, and I don't balk at it, and they don't balk on it. If anything, sometimes they feel a little bit more proper But they, they're always, everyone thinks that estradiol is a bad thing. It's not as bad as people think it is. It's like when I give a female that needs cream, who's a little older and she's got a dry vagina, when we put their cream in there, it's estradiol and testosterone, both. So, but they never question that. The patients never question that. I never thought about it until today. Like, wait a second, she's not talking about testosterone. So if she's talking about testosterone and estradiol, why aren't the guys talking about similar things? Right. But in the same way, know? So it's kind of like, whoa, it's a unique thing. But yeah, as far as estradiol, I think a number of 60 is very reasonable. Going up to the highest number on testosterone, like you and I were discussing earlier, why? Why do you think you need that? And if you're going to do that, look at your blood work and tell me how thick your blood is before you have a stroke. Okay? Are you going to tell me that you're going to go in there and have your blood drawn and removed 3 times a year? Well, if you need that to be done for you, think about why you have to have it done. Right. That is the major problem. Not that you can just go to the lab and get sucked out, because I do therapeutic phlebotomies on my patients all the time, because they don't want to go to the drug place, and it's, they're in and out in 15 minutes, and I'll make you laugh about what I do with that blood. My father taught me this when I was a little kid, and he was still a physician alive. He would collect the blood from his patients when he was drawing blood at his office, and he would take it home. And he'd have it all wrapped up, and then he would give it to my mom, and my mom would punch the holes in that plastic and dribble the blood onto the flowers, mostly roses. And they grew like banshees.
Wow.
So what the heck? It's the crazy stuff that we come up, and it made it grow. And why not? Because you got all this blood that you had too much of it. So that, you're doing something good. And that, phlebotomy is important, because you start getting up there. I see those numbers, especially with guys that are training to become police officers, and they got to take their physicals. Some of these guys on purpose have just jacked it up. They're 20 years old and they're all jacked. I'm like, okay, all right, we'll see when this happens. It is what it is, brother. It's a fascinating world that we try to point in the right direction, and sometimes we win and sometimes we don't.
Well, look, I know you got to go soon, so we'll wrap up in a second. Final question is, have you come across any peptides that improve thyroid health and function?
To be honest with you, the true answer is no. I've seen a lot of things. I've had patients that played around with iodine.
Right.
It's really nasty tasting.
Yeah.
I think there has to be something, and it's hard because there's typically 2 thyroids out there and they're fighting to each other. And what I don't want to see is these doses have to go up and up and up and higher, because if you've got a level of 60 and all of a sudden you need 120, you're like, well. So that's when I try to go, if that's the case, then I want your thyroid to be checked, by the lab and also by radiology to see if you've got any tumors or anything like that, because it can, why does that happen? Why does thyroid go down low? Most likely it's dietary. You're having some blend of some food that you're eating or not eating, and it's blocking it, which no one ever talks about. Because you can have, I have, men and women whose estradiol levels go up and down. Well, guess what? Thyroid changes also up and down too. And to me, thyroid's as important as testosterone, estradiol. So, I don't have a good number yet. I would hope that in the next year or so, something will pop that's unique.
Yeah.
But it's challenging. I think it would have to be herbal at this point in time for us to get it.
Is there anything in the pipeline that maybe is not on the market yet that excites you? Is there anything you've looked at where you're going, oh, that looks like it could be a winner?
Unfortunately, it's been the reverse, because the feds have taken so much on the peptides side. I'm happy in the sense that things like BPC we find that they actually have some good brains, forces that helps. AOD 64, that we talked a little bit about more, and we will in the future, mostly for fat, but it's a unique fat because it's not fat like a fatso. It's fat because their skin, their anterior skin and skin only is that's what goes away. But then the AOD is also great for working out. Guys love it, for periods of time. So it's a matter of balance, and unfortunately, they've taken so much of us away. I will say that a lot of the pharmacies, the compound pharmacies, have been very good about manipulating some of these things to make it almost the same, the old stuff. And we can talk about that some other day, but that's happened a lot. Is a lot of the things we used to have, like boom, gone. Why? Well, because they said that there was animal products in there. I go, you mean like the stuff in insulin?
Yeah.
Well, we're still taking this away. And this cerebral lysine was a very important part. It came from Europe, and it did so much good for humans, especially for people that had Alzheimer's and that kind of stuff, because it's right there. I mean, the stuff was in your brain like almost immediately, and they took it away. And it's tragic that we've lost so much of that stuff. And we keep, those of us that do this peptide stuff, we keep trying, but man, it's hard. I'll keep you posted if I hear anything new and improved. Sure.
Yeah. Oh, final thing, and we can make this real quick too. With Kisspeptin versus Clomid, both of them work in a similar mechanism, right? Increasing LH and FSH. So yes. It would probably be redundant to take both at the same time, or even possibly an even negative outcome if you took both at the same time. But is there one that you prefer over the other? Is there any reason to lean towards Kisspeptin versus Clomid or vice versa?
Well, I'll tell you, that's an interesting conversation because they're similar yet different. Okay. We've talked about Clomid and we know what Clomid does and what it can't do. Kisspeptin is more like HCG,
Okay.
In the sense that it's going to act, it's sending signals out there on a daily basis to have that person take the HCG and create it so that it functions, just like the Clomid. So that's kind of the scenario that plays out. I have patients that like Kisspeptin, and I have patients that prefer Clomid. Is it something you could do both? I don't know if I would do both. If you're doing good with Clomid, stick with Clomid. The Kisspeptin is a little bit more of a hassle. It's an injection.
Right.
That shakes a lot of some people away, even though it's a tiny little amount. So but it's popular. It's easy. It's around in Vegas in a number of different compounding pharmacies. So do I write for it? Yeah, some people want Kisspeptin. These are the ones that had HCG way in the back, and
okay.
They haven't started taking Clomid because they're trying to really be, under the radar, so to speak.
Right.
For Clomid, Clomid's a great product. So I can't say, you shouldn't take Clomid because you should take Kisspeptin instead.
Yeah.
When everything,
There's some pros that Kisspeptin has that Clomid may not have. Like maybe Kisspeptin doesn't have a negative impact on IGF-1, for example, or Kisspeptin has some other benefit besides increasing testosterone.
Yeah, I haven't looked at it to figure that out whether it is or it isn't.
Yeah.
It would make sense that they would have some overlap, but
right.
It's like the peptides. When we were talking about peptides before, the thymosin alpha and thymosin beta, when we had them, there was overlap. Those things they're not pure. Even
right.
something so small as that, it was not pure because they were so close to one another.
Right.
And I think that there is some similarity with Kisspeptin and Clomid, but they have their differences, for sure. Might be something if they want to play with it. All right, instead of 2 on Clomid, take 1 and then take a low dose of Kisspeptin and see what happens. I mean, if you wanted to play, that'd be one way to play.
That's the kind of thing I do. I just out of curiosity more than anything else. Like,
so that's what you're going to start tomorrow. You're going to take it tomorrow. You're going to take both. You're going to take only 1 Clomid You got to take 2 Kisspeptin, and you got to give me the report.
All right, done deal. Well, hey, I'm going to put your website information in the info below and your social media and all that so that people can find out more about everything you have to offer. You're based here in Las Vegas. Do you do distance consulting as well, or is it just people in?
Yeah, whatever they can do long distance, we try to help them out because it's gotten a little bit harder, especially with Rapamycin. I do a lot of my Rapamycin off the city here. So yeah, anywhere that they would be able to come and want to come, I'd be happy to help. And as always, you're a gentleman and a scholar. I really love your time with you, and we'll have to do it again sometime.
Thank you. Yeah. I love it. Thanks for all the time. Great information as always. It's been fun. Got a little rant out, so I feel better now. I feel nice and cleansed and go on with my day. All right.
All right, buddy. You have a good day. Have a great one. Thanks.
Yep.
Bye-bye.